Good day everyone. I am Mariah Angela F. Pineda, a student from BS Nursing 2 in College of Our Lady of Mount Carmel. So the procedure that I'm going to do is applying wound dressing using the PHN bag technique. So first, upon the arrival on the client's home, we have to greet and introduce ourselves to the family. So hello Family Ramos, I am Mariah Pineda from College of Our Lady of Mount Carmel. Then, assess the client's needs, establish rapport between the members of the family to promote cooperation, identify the client, and explain the procedure to the client. Then take the client's history, and then ask them if they have any flat surface like table, chest, or box, and if none, we can utilize the floor. So now in placing our bag, we have first to prepare for the plastic lining. So the clean side will be out and the folded part will be touching the table. And next is the clean paper. Again, the clean side will be out and the folded part will be touching the surface. And now we're going to place our bag at the left corner, making sure that the straps will be under the bag. And the rationale for this is to prevent the bag from being contaminated. Now ask for a running or tap water, and if there's none, we can ask for a basin of water or a glass of drinking water, and the rationale for this is that it will be used for hand washing. Then open our bag and get the towel and the soap with the soap dish. And the rationale for this is that for preparation for hand washing. And now we proceed with washing our hands with the soap and dry our hands with the towel. And the rationale for this is that it will prevent infection from the care provider to the client. And after that, we're going to place this here. Then, take on the apron. And the rationale for this is to protect the nurse's uniform. Now we're going to put out all of the necessary articles needed for this specific care. Since we're going to perform the wound dressing, we're going to take out the materials needed for wound dressing. And the rationale for this so that it would be readily accessible. Now we have to close our bag. And place it in one corner of the working area. And the rationale for this is to prevent for contamination. Now proceed with the nursing care we need to do. Now, since we don't have a patient, assuming that this will be our patient, so we have to provide for privacy. So, assuming that we have draw the curtains and close the doors, rationale for this is to provide or to maintain client comfort and also to provide privacy once the body is exposed during the procedure. And then we have to explain to the client the procedure, and the rationale for this is to provide information about the procedure and to reduce the level of anxiety. Then, after that, we have to apply exam gloves. And the rationale for this is that this will serve as an infection control and protection from body fluids. Now we proceed with removing the dressing, and we have to remove our soiled gloves since it will be contaminated, and apply it or put it on the appropriate receptacle. So first, remove the dressing. So sir, I will be removing your initial dressing, okay? Then again, we have to place it at the proper waste receptacle. And again, we have to remove the soiled gloves with the contaminated inward and place it on the appropriate receptacle and apply new clean gloves. And the rationale for this is that the dressing and the glove soiled is considered contaminated, and it is subject to biohazard disposal of the correct manner and also as per institution protocol. Now, it is a standard that the surgeon will put on the initial dressing after or post-operative, and the initial dressing must be maintained 24 to 48 hours post-operatively unless the condition of the dressing calls for a physician or qualified practitioner for a dressing change order. And until the removal of initial dressing, the nurse will reinforce the dressing as needed. And the frequency of dressing change depends on the need of the wound and the preference of the physician and the qualified practitioner. And this is usually specified in the orders. Now moving on, we have to assess for the appearance of the wound bed healing. So rationale, we have to assess for redness, foul odor, swelling, irritation, drainage, dehiscence, bleeding, and skin breakdowns. Then, we have to cleanse the skin or the surrounding area on the incision if necessary with a clean, warm, wet washcloth. And the rationale for this is that dried blood or drainage on the surrounding area may cause irritants and also a medium for microbes. Now, if the suture line requires cleansing, it should be done gently and use normal saline, half strength of hydrogen peroxide or betadine swab, and cotton tip applicators using a rolling motion, and clean from the cleanest to the dirtiest. But still, we have to consult for orders of the physician or the qualified practitioner or the hospital policy regarding the aseptic agents. And the rationale for this is that the suture line itself must not be disturbed unnecessarily. Now, the used applicators must not be reintroduced into the sterile solution, and the rationale for this is that the reintroduction of the used or soiled applicator into the sterile solution will make the solution contaminated. Then again, we have to remove our exam gloves. And this is the proper waste receptacle. And the rationale for this is that the exam gloves used to remove the old or the initial dressing is considered dirty and should be removed and discarded properly. Now we have to again wash our hands and perform hand hygiene. Then now we're going to set up the supplies. Then moving on, grasping just the edges, apply a new dressing using a 4x4 gauze, folded in half to the 2x4 and place the folded gauze pad lengthwise on the wound and tape lightly or apply tubular mesh for those with sensitive skin. And then we have to record for the date and time that the initial dressing was changed and also the new dressing. And optional, an ABD pad may be applied on the top of the dressing for added protection over the sutures or the client comfort. And for the rationale, a light dressing of 4x4 pads may be the only dressing that is needed to protect the incision from closing or to collect a small amount of drainage, and this maintains of the dressing change for the next nurse. And also, do not forget to put on the date and time on the dressing. Then again, we have to perform hand hygiene and observe infection prevention control. And the rationale for this is to prevent infection from the care provider to the client. Now, moving on, we have to conduct the client or family education about the dressing, which may include teaching the dressing technique to the client or family. So, cerramos. Then cerramos. Now that we're done, after giving the treatment, we have now to clean all of the things or the materials that we used for the procedure. Then put the clean materials at the clean side of the table. So this will be the clean side and this will be the dirty side. Then discard all of the contaminated materials like the cotton balls to the proper waste receptacle. And the rationale for this is to protect the caregiver and provide protection from infection. Now we're going to open the bag and return the supplies or the materials in their proper places. And the rationale for this is that it educates the client or family in preparation for discharge. Now we're going to remove our apron and holding it away from the person. By folding it, the soiled area will be inward. Going to place it at the plastic receptacle. We're going to close our bag. Hold it properly. Then fold the lining. Fold the plastic lining. Then in the plastic receptacle, then discard. Then, take the record and have a talk with the mother and write all of the necessary data that were gathered, observations, nursing care, and treatment that were rendered, and give instructions of the care on the patient in the absence of the nurse, and make an appointment for the next visit in the home or clinic, and take note of the date and time, and the rationale for this is for preparation of the follow-up care. And that would be all for today.